Well, this is an ultrasound study of a known case of hepatitis C, diabetic, and the liver is showing you chronic liver parenchymal changes with outer surface seen mild irregularity of the outer surface can be seen. In this case here this is the outer surface of the liver and it is bit irregular, and you can see the coarseness and increased parenchymal lipogenicity, that of the liver parenchyma. And here is the portal vein. The portal vein measures approximately 13.6 millimeters, and up to 13 is normal, so portal vein is mildly dilated. This is the gallbladder, and you see the walls appear thick because of the adjacent liver parenchymal changes. So this is the left lobe of the liver. This is the transverse section of the left lobe. Here you can see the ascending part of the portal vein, left portal vein. This is the left portal vein and the branches entering into it. So this is a case of chronic liver parenchymal disease, fine enough with no focal lesion seen in it. Now, second thing to notice, see the kidney, see the renal parenchyma, see the central sinus echo complex. The kidney measures centimeters in length and 3.9 centimeters in anterior-posterior diameter is normal in dimensions. The central sinus echo complex is muffled. The parenchymal echogenicity is raised, diffusely raised. The thickness of the cortex is preserved. Corticomedullary differentiation is though intact. And if we compare with the liver, adjacent liver, the normal is that the echogenicity of the renal cortex or parenchyma should be equal to that of the liver or slightly less as compared to that of the liver parenchyma. But in this case, you are seeing that the echogenicity is diffusely raised throughout. No calculus or focal lesion or any other finding is seen in this kidney. And there is no hydronephrosis seen. You can see the prominence of the pyramids. These are the pyramids, and you can very well note the prominence of the pyramid in this particular patient. Now let's go to the left side, and see that what is the measurement of the spleen. This is the spleen. From pole to pole it measures 11.3 up to 12 centimeters is considered normal. So this is not unlike the spleen. Now see the left kidney. Left kidney shows all the same findings as we saw in the right kidney. You can see that there is diffuse raised parenchymal echogenicity, there is prominence of the pyramids, and there is mufflings of the central sinus echo complex, and it measures approximately 8.6 by 4.1 centimeters. The dimensions are normal, but again now the echogenicity of this kidney is raised more than expected normal. So both kidneys are showing grade 1 renal parenchymal changes severely. Now you see, if I compare the echogenicity of this kidney with the liver, लंबा साल है वो, रोको बाजी साल है कि रोक लो, हाँ रोको एक सेकेंड बस, ओके ठीक है सारे लोग ठीक है, and this is the liver. Now compare the echogenicity of the liver with that of the, though the liver is not normal, and the parenchymal of the echogenicity of the liver is diffusely raised and coarse, but even then the echogenicity of the kidney is more than the liver as well as the spleen. Now here is the spleen. See, the echogenicity of the liver cortex is more as compared to that of the spleen. So this is a case of cirrhotic liver or a patient and with bilateral renal parenchymal changes of grade 1, and this is the fluid in the peritoneal cavity. There is ascites. This is the uterus in longitudinal section. This is the fluid that you are seeing in the pelvic cavity, and there is fluid in the peritoneal cavity as well, though a small amount, but is present. This is the fluid that you can see, and these are the bowels floating in the ascitic fluid. So this is our case of the day, which pertains to two pathologies. One, the chronic liver parenchymal changes with ascites. Second, bilateral renal parenchymal changes, grade 1. Thank you very much.